Hi everyone. So today I wanted to cover some basic tips and principles for draping and degowning. We will demonstrate some more specific things that you can do as we go through our physical exam sessions throughout the year, but today I want to cover some just basic principles to get you started. You should never try to do a physical exam through clothing or through the gown. As you can imagine, trying to auscultate something through the stethoscope can oftentimes muffle the sound or even introduce artifacts that can make it more difficult for you to get a good exam. Likewise, you can't really inspect through the gown. You can't diagnose a rash or even see a nodule if there's clothing covering the area that you're trying to inspect. You should also never try to do physical exam through clothing on your clinical examinations, whether here at UC Davis or on your Step 2 CS. That is a surefire way for you to lose points, and we definitely don't want you to do that. To paraphrase from another profession, you should train how you test and test how you train. If you always practice doing things the proper way every time, you won't have to spend time and precious energy trying to remember what the right way is to do something under the high stakes, high pressure environment of a clinical examination. Finally, most patients expect to be degowned as part of their physical exam when they go see their medical provider. And so it's really important for you to develop some comfort and some skill with this process. So the big challenge with draping and degowning is balancing the need to expose the patient to be able to do a physical exam and to see what's going on, but also being attentive to the patient's comfort and also to their privacy. So with that being said, there are 4 basic tips I want to reinforce. Number 1, pay attention to the environment that you're in. If you're in a clinical exam room, close a door. But if you're in an open area or an area where there are multiple gurneys, draw the curtain closed so you can have some additional privacy when you do your physical exam. Number 2, provide some anticipatory guidance to the patient. Explain what you're about to do, and more importantly, explain why you're about to do it and why it's important for the patient. So next I'd like to inspect your abdomen for any scars, bumps, bruises, or rashes.
Okay.
Number 3, ask for permission. Or you can also ask the patient to help you with the draping or the degowning process. I like to use inclusive language such as we instead of you to make it more of a partnership. So is it okay if we have you bring your gown up so we can inspect your abdomen next?
Sure.
Okay. Oftentimes you'll find the patient will actually do much of the work of degowning and draping for you, and they will also probably expose about as much as they are comfortable with. Finally, number 4, minimize the amount of time the patient is exposed to just the time that you're actively examining that area. You'll find that there's often not one right way or one best way to drape or degown your patients, and we will try to demonstrate lots of different alternatives both explicitly and implicitly as we do our different sessions throughout the year. Also, please take the time to contact your facilitators and ask your preceptors their own tips and suggestions on how to handle difficult or challenging situations. Finally, don't assume that men may have different preferences when it comes to draping and degowning than women. You may find that for a variety of cultural, religious, or even body image issues, men may be just as uncomfortable with exposing certain parts of their body as women are. Treat all patients the same, and you will be well on your way to a long and successful career. All right, so that's basically it. Please send me any comments, questions, or suggestions to ajbhe@ucdavis.edu. Thanks for watching, and we'll see you all next time.